Assalamu alaikum, everyone. My name is Dr. Rabeea, and I'm a consultant urologist here working in Bahrain Specialist Hospital. And today I'll talk about urinary tract infections, especially in pregnancy. Okay. So now let's talk briefly about the urinary tract. Actually, the urinary tract composed of or comprises of two kidneys, two ureters, one bladder, and one urethra. Any abnormality, any issue along any part of the urinary tract causes urinary tract infection. So what happens in the urinary tract during the pregnancy? Actually, with the advancement of the pregnancy, the kidney size enlarges. The collecting system inside the kidney, which collects the urine, it also becomes, swollen or dilated or bigger in size. And the blood flow to the kidney is also increased during the pregnancy. This is actually the normal physiological changes that happen in our body during the pregnancy. So these changes also occur in our kidney and the entire urinary system during the pregnancy. So these are the normal physiological changes which we cannot avoid, right? So the blood flow to the kidney, is also increased, which results in increased filtration, and other biomedical changes also occurs in the body, like change in electrolyte or other constituents in the blood also. Now, what happens in the lower urinary tract during the pregnancy is that with the advancement of the pregnancy, the size of the fetus increases. There is a lot of pressure of the fetus that goes upon the urinary bladder, that goes on the urinary bladder. So what happens is like that, the bladder displaced a bit, and later on more with the advancement of pregnancy to the side. As the pregnancy progresses, the bladder displacement occurs. There is increased flow to the bladder happens. And sometimes it also happens like that because of the pressure of the fetus or the uterus over the bladder, the capacity of the bladder also increases. The blood pressure and the bladder pressure also increases. There is a increased risk of non-visible hematuria. Means like that when we go for urine analysis because of any reason, we will find that there is a little amount of blood is going in the urine, which is not visible to our eyes, but on the microscopy, we can see that. It can be because of the pregnancy. And there are other lower urinary tract symptoms like patient going to toilet more frequently, they are passing small amounts of urine, and they feel like that even they are finished with the urination, but still there is some heaviness over there. So they feel like that there is an incomplete bladder emptying, but they are unable to pass urine. And sometimes also happens like that they are unable to pass urine and there is a urinary retention because of the gravid uterus or the pregnant uterus. And sometimes also happens like because of the pressure of the pregnancy or the weight of the pregnancy, there is little leakage of the urine also occurs while coughing, while sneezing, while standing from the sitting position. So what actually is a urinary tract infection that occurs during the pregnancy? It can be asymptomatic bacteriuria, means the bacteria or the germs are there in the urine, but the patients are asymptomatic, means they don't have any symptoms, no urinary symptom, no associated symptoms of urinary tract infections like fever or vomiting or flank pain or lower abdominal pain. So asymptomatic bacteriuria accounts for 5 to 10% of the pregnant females. What we call asymptomatic bacteriuria like that, two consecutive urine samples, they show bacteriuria, but the patient is asymptomatic, it means that it is asymptomatic bacteriuria. Or if we are taking urine sample with a catheter, so it is a clean cat sample and that sample has very less chances of infection. So if even in that sample, if the bacteria comes in the urine and the patient is asymptomatic, we should treat it as asymptomatic bacteriuria. And the best management of it is that whenever there is a asymptomatic bacteriuria is seen in the pregnant female, it should be treated. We should not let it aside because If it let it be as it is, and if we are keeping the patient on observation, if it remain untreated, it can develop into pyelonephritis, which means that the ascending infection to the kidney means from the bladder, the infection goes to the kidney, and it happens in 20 to 40% of the cases in pregnancy. So it is one of the most severe things, one of the most severe consequences of the of a simple urinary tract infection. And pregnant females are more prone to it. Now, what is symptomatic bacteriuria? 1 to 3% of the patients, they present with the bladder symptoms, like they are going to toilet more frequently, they are feeling pain in the lower tummy, they are feeling pain while passing urine, they are feeling burning in the urine, or they are having urgency. But out of that 1 to 3%, 1 to 2 patients can develop into acute pyelonephritis, and it is more frequent in the pregnant female than the non-pregnant female. As I told before, that the pregnant females are more prone to get infections than the non-pregnant females, and especially it happens in second and the third trimester, because of the weight of the pregnancy, the patients are unable to empty their bladder completely in this with the progress of the or with the advancement of the pregnancy. It happens mostly on the right side. Why? Because it is the normal body shaping is like that, because our uterus, when it is with the advancement of pregnancy, the uterus gets to the right side because of the normal anatomical position of it in the body. It exerts some little pressure on the right kidney tube. So it causes right-sided pain, right-sided kidney swelling, vomiting, and infections more on the right side. So right side is more prone to the infection than on the left side. The other risk factors for UTI in pregnancy are the recurrent urinary tract infection. For example, some person who is pregnant, right, who has got infection of urine during the early pregnancy or the second trimester or the third trimester. If it is early in the pregnancy, then she's more prone to get urinary tract infections later in the pregnancy also. So we should take care of these females more so that we can avoid the infections. And if in a person, if there is any pre-existing anatomical or functional abnormality, like any stone history or any operation history or any issue with the uh, function of the kidney, so they are more prone to get infections. And last but not the least, diabetes. The common pathogens are E. coli most of the time, followed by Klebsiella, Proteus, and Pseudomonas. Now, what are the complications of urinary tract infection? It can lead to preterm delivery. It can lead to low fetal birth weight. There is a risk of intrauterine growth retardation and maternal anemia. So what are the screening tests for it? Midstream urine at the first antenatal visit to look for bacteria, protein, and blood. We should screen all the pregnant females for this. And repeat midstream urine recommended at later antenatal visits, particularly in patients who are high risk, and high risk are patients who have recurrent urinary tract infections, who have anatomical or functional urinary tract abnormalities, or the diabetic females. So the treatment options. All proven episodes of lower urinary tract all proven symptoms of lower urinary tract infections are treated whether asymptomatic or symptomatic. They are guided by the urine culture and they are being treated according to the sensitivities available, right? So there is a normal treatment for the cystitis, or the simple cystitis is like that, 3 to 7 days. But if the patient develops pyelonephritis, means there is ascending infection to the kidney from the bladder, there's a treatment of 10 to 14 days minimum. And we need to repeat the urine cultures after the completion of the treatment in order to make ourselves sure that yes, the infection has been treated completely. So repeat urine culture is mandatory. And the safest drugs to be used in pregnancy are penicillin, cephalosporins, clindamycin, and azithromycin. So the key to avoid urinary tract infections during the pregnancy or any time during the life is like drink more water, especially in the summers, more than 2.5 liters. We should not hold urine for longer times in the bladder, like every 3 hours or maximum 3.5 hours, we should go and empty the bladder even without any desire to pass the urine. Because the longer time that urine will remain there in the bladder, it will cause bladder irritation and later on infections. We should use probiotics, we should take care of our hygiene, and we should keep ourselves clean, we should avoid constipation, and by all these means, we can prevent the urinary tract infections. Thank you.